person. Mr. and Madam Chairperson, fellow academics, members of the audience, Assalamualaikum warahmatullahi wabarakatuh. Good morning to all of you. I presume you can hear me well, huh?
Yes.
Yeah, okay, good. That's good. I'm going to do a slightly different stint this morning. I'm going to address and relate my personal experience over the last 25 years in a major apex university. And as you know, in any setup of a public university, there is immense pressure for us to publish. Immense pressure for us to publish. And what I'm going to do is to relate to you how my coping mechanism of how I manage, I think, to come out from that pressure over 25 years with my sanity, I think, preserved, with my hairs probably okay, and with enjoyment in my life. This personal experience is something that I had to go through because, okay, as you can see from the slides, can we have the slides, please? Okay, as you can see from the slides, yeah. A second slide, please. When I returned to Malaysia from overseas in 1991, I don't understand publication and research because I was working as a clinician through and through, and I'm a pediatrician, and I'm still practicing as a pediatrician now. I have 0 citations. I don't understand age index at all. And little did I realize that when I stepped my foot into what was going to be an apex university, the expectation was more than a clinician. The expectation was how to preserve the apex university's ranking, and with the ranking, how to maximize the research output. And throughout the journey over the 25 years in USM, I had the chance to be the head of Department of Pediatrics, Deputy Dean, and eventually the Dean. And at that various points in my life, I managed to see how people suffered, how clinicians especially suffered, and how the clinicians became very, very tired. And often, sometimes leaving the care of the patients to junior medical officers and not leading treatment and not being seen as a role model in giving medical treatment to patients. People have come to me at the time of my leadership position, complaining that they have to compete with their kids doing the homework while they have to write papers. And that's very, very distressing. And I've seen also clinicians who really basically have had to leave the university because they could not cope with the pressure of having to publish because they don't understand publication. Just to relate my own experience, former pediatric professor Hamish Simpson said to me that when I first attempted to write a paper, he said my paper was a novel. It's not a Nobel winner, but it's a novel. It's a storytelling. So that was how us clinicians were not aware or not trained to do this. And eventually there is a potential waste of resources in the university because we keep looking good clinicians who are very, very good at treating patients, but needed help with publications. And in that position also, I managed to see how people cheated, how great clinicians turn into pseudo-authors, and how great clinicians retreated into their own offices And instead of treating patients and being seen to be treating patients by the students, they retreated into their bunkers for writing, because writing became a KPI. And that left the medical students in a lurch. Next paragraph, next slide, please. I'm particularly interested in this study published in 2009. Can we make it slightly bigger, please? I can't see. Regarding the burnout physicians, the saying the finding from the Archives of Internal Medicine, published in 2009, says that physicians who spend less than 20% of their work effort on the activity they find most personally meaningful are nearly 3 times more likely to be burnt out than those who spend at least 20% of their work effort on such an activity. Meaning to say that if they spend too much time on something that they don't like doing, that can lead to a burnout. And this is published in that particular journal. So over the last 25 years, in that particular university, I had to try to look for coping mechanisms. And that is on my slide number 4. Can I have a slide number 4, please? Hi. Can we have the next slide, please? Yeah, on the tips and suggestions, I think from my experience, clinicians will have to work with non-clinicians to publish. And a lot of my co-authors and co-researchers are non-clinicians. I work with sociologists. I work with mathematicians. In UTM, the study was how to make a best guess in epilepsy. When will, you know, I don't know whether you know the EEG. The EEG tracks the brain rhythms for epilepsy. And when I work with a mathematician, the mathematician showed me a formula of how you can guess where the abnormal waves were coming from through a mathematical formula and mathematical calculation. So I worked with UTM and we published that paper. Also, we have worked with experts in remote sensing now. I don't know whether you're familiar with remote sensing. Remote sensing is a satellite technology where using the technology, you can guess the fertility of a soil in an area. You can guess the rainfall. And I engaged with them because I knew that the problems of malnutrition is linked to geography. So we look for experts in remote sensing, and we found experts in remote sensing. And I gave the medical input to people in remote sensing. And they created the parameters of rainfall, of flood, of soil fertility, observed through the satellite, and put all this data into a software called Geographic Information System. They needed that medical input, but they could not find someone who could give that input. So you engage with them, and they came out with and this paper has been presented in the Royal College of Pediatrics in the UK, last week, and published in the Archives of Disease of Medicine, of Disease of Pediatrics. I work with dietitians. In fact, my last PhD student is a dietitian. And we went through a dietetic pattern of handicapped children. I work with nutritionists. I work with physicists. And the last master students graduated was not a medical doctor. She was a physicist. And the project we worked on was how to produce a phototherapy that can be used at home and not in hospital. And we call that project Bili Baju. And we put LED linings, LED lights on this on the baju, and mothers could use them at home, because being at home will make them have more bonding with the children, with the babies, and not in hospital. And I work with business colleagues, and I know there's a lot of health-related data that business colleagues work. So I think you really have to find all that kind of, you need to expand your field of interest. You need to force yourself to look for non-physicians, non-clinicians to help you out. And that is what I mean by working together. Now you have to be careful with this, because sometimes people say that they work together, but when they actually, what they actually meant was to work to gather their own fame and their own glory. So there are two different meanings to it. You know, sometimes people say that they're working together, while in actual fact that it is not working together as a team, but once the product has been launched, once a paper has been published, it is to gather their own fame and their own glory. So we can pick up people who have this kind of tendencies. I think we have to acknowledge and give credits on publications to institutions. I think increasingly now institutions are being credited and not individuals. Because when I was dean at one particular stage of my life, a PhD student came to me crying. She said that she has done all the work, all the papers that came out from her PhD, but her supervisor insisted that the supervisor's name is to be put in front. So these are damaging for your reputation, damaging for the students, and also damaging for the and also ethically damaging. Amongst other things that we can help from my past experience was to organize writing retreats. And from one of those retreats, together with my scientist friends and other people, we managed to publish 6 books, would you believe it? 6 books. And what we did was, we went to Bacho, not far, but everybody has to bring their own family. Went there, and while the families are enjoying their life in the swimming pool and so on, the writers spend their time in the library of that place writing. And this is not exaggeration. We managed to publish 6 books together with Professor Teguh from that exercise. So maybe this is something that you need to consider. You also need to consider maybe an internal sabbatical leave, for example, where maybe not known to the dean, just arrange amongst your colleagues that you will have 1 week of writing while others do the job for you, teaching and so on. So I think this approach was an approach which was practical, an approach which I think worth trying to keep your sanity intact. From 0 citation, 0-ish index, I think I didn't do well because I needed 25 years to produce a H index of 15 and citation of about 600 or 700. No, not well. Not well at all for somebody who, I'm not comparing to even Dr. Nurhanis, and certainly I feel ashamed because I don't have that many publications compared to our own Prof. Shaiful, for example. But I think I can retire with a smile. I can retire with knowing so many people that I've engaged throughout my career. and I think I retire a happy man. Thank you very much for your attention.